I am from Toronto, Canada. I will be 81. From an endoscopy, I've been treated for GERD and Barrett's esophagus. But so I had an endoscopy, and that's when the doctor found it. And everybody in the family started researching. Brian lives here in Madrid, so he notified us immediately as soon as he heard, and the process went from there. And we had a Zoom meeting with Dr. Calvo and Dr. Martin, and that was an exceptional meeting and gave us a lot of confidence.
Harriet has early stage localized esophageal cancer, in which the treatment option is the standard of care for this kind of patients. In a profile such as Harriet's, given her advanced age and important comorbidities, surgical treatment may entail a higher risk of serious postoperative complications. Then, proton therapy opens up as an alternative for a radical intent treatment for this kind of patients for early stage localized esophageal cancer.
I've been living in Madrid, and I've heard a lot of great things about the main hospital in Navarra, and also people in my work talked about the fame of the cancer treatment clinic here in Madrid and its new equipment. So I heard about that before my mother was diagnosed.
In the case of elderly patients and ancient patients, senior cancer patients, we have to be extremely careful because they have tissues that are damaged by chronic diseases, and this chronic status is what makes radiotherapy to be as less toxic as possible, and what brings proton therapy as a major argument for the treatment of old patients. It is exactly the same argument we use with children and with pediatric patients, that we try to preserve the normal tissues long term. In the case of the elderly patients, it is not that long term, but their tissues are weak enough to be cared as much as possible by the use of radiation therapy.
I certainly felt cared for, that's number one. And obviously if I said I was excited, that indicates that I was very comfortable with the treatment itself.
The fact that Harriet has been accompanied by the personnel of translators here in the clinic has allowed her to interact with the medical team, the personnel, and everyone that has accompanied her during this time. It has enabled her to feel almost at home, despite being so far away from Canada.
Getting a cure. Everything was perfect. Everything was beyond expectations. She had virtually no side effects of the treatment, and she felt very relaxed and comfortable and felt good.